Right. Hi. We did cognitive behavioral therapy. So some of the historical origins about this is that it was founded by a professor or a doctor at the University of Pennsylvania back in the 1960s named Dr. Aaron T. Beck. He was looking at initially like psychoanalysis was his like primary specialty, which is basically just whenever you work with someone who is suffering from anxiety or depression, and it's basically like having them like bring up like negative memories and then being able to like fight those thoughts, and you look at both their conscious and like subconscious mindsets. So basically he was like, people with depression have a negative view of the world and themselves, by viewing these thoughts in more of a realistic fashion and realizing like, oh, this wouldn't necessarily happen in this way, could change the client's outlook. He then coined this cognitive behavioral therapy. So it has been found to help in psychiatric problems, psychological disorders, and even in medical problems that may involve like a psychiatric component to whatever the client is currently going through. All right. Some of the key concepts within this is that the professional is looking to work to help the client change the negative views into realistic ones, like I said in the previous slide. This is kind of looking at a client's, it would be called automatic thoughts, which are basically just like those thoughts that are just like spontaneous and just pop up out of nowhere. And the best way they found to battle these were to use alternative ways of thinking, apply them to the issue that is currently at hand and what they're kind of going through, to then decrease the amount of psychological tension that the client experiences whenever these automatic thoughts kind of occur. So some of the core principles when looking at this is that you'll find the cognitive triad. This is basically just looking at like 3 different things that kind of all affect each other in some way. These include thoughts, behaviors, and feelings. So basically, whenever an individual is has a bad experience, that then affects the way they feel. And then they begin to feel a certain way, like certain skewed or erratic emotions, which can then lead to irrational actions.
So how it will create change. So first, that diagram kind of shows like the cycle that we can have with our thoughts, like upset feelings turns into unhelpful behavior, which turns into negative thoughts, and it's just a big cycle. So this helps to break that and change that, and change their perspective and way of thinking. And one way of doing that is becoming more aware of their negative thoughts, and making these thoughts aware can help the client stop the thought patterns and then relate their thoughts in a different way. Another thing is changing attitudes and behavior by focusing on their cognitive processes and how that relates to the way they behave. And goal setting goals to change the patterns with your client is extremely important to help create effective change. And then help to deal with emotion-filled thoughts. So negative thoughts may pop into your head, and with this therapy, it focuses on rewiring those thoughts into something positive. So an example of like a negative thought would be talking to your boss, and you start to just think in your head, like, is he upset? He hasn't been talking. I wonder if he's annoyed with me or upset. And these thoughts can cause someone to just start spiraling. So it's important to try and rewire those thoughts. And then identifying that you have those thoughts is also a huge step to making change. And then changing your negative thoughts. Negative thoughts can block new ways of thinking and can stop you from living up to your full potential. And so it's important to recognize that. And also the focus of this isn't on the event itself that caused these thoughts, but it's the reaction and the attitudes to it that will be the main focus of it.
So if we look at CBT, when you want to know exactly how it has been used in social work in the practice, it's important for social workers to have both an understanding of cognitive theory and behavioral theory, which has roots in psychology, which will be discussed. So as you can see, the principles and theories are kind of at odds with each other, and it's kind of difficult to integrate it. So if you look to the right, there's the environment versus the mind, action versus information, and behavioral versus cognitive. So looking at the psychologists, there are behaviorists, also known as positivists, and they believe that you are completely a product of your environment. And an example of this would be Pavlov with the experiment with the bell and the dog food. And then there are cognitive psychologists, also known as constructivists, and they believe that your thoughts made your reality. And in that meaning that your thoughts completely made the way that you see the world. And the actions of Bandura actually integrated the two. And so we observe the environment and model behavior. And that is known as social learning theory. So CBT and social work. It is often used with person-environment perspective, a strengths perspective, and an empowerment. And it is often used with anxiety-ridden tendencies for the most part, such as obsessive-compulsive disorder, trichotillomania, or agoraphobia. So as mentioned previously, they are kind of at odds with each other, and it's kind of difficult to balance the two theories in practice. Oftentimes, social workers will use cognitive theory as a basis of explanation and then bring in behavioral theory to integrate model-directed behavioral techniques. And as mentioned previously, they can also use the CBT triangle, and you can also think of it as ABC triangle as in affect, behavior, and cognition. And it really shows the integration of these two theories. So when used in practice, all three of the triangle points must be considered on how they interact. And since everything's connected, there is no one way to arrive at an issue, and there is no one way to solve it either. So it really is tailored to the individual or the group clientele that you're working with.
So the empirical study of CBT in social work practice. So extensive research supports that this is effective for a wide range of psychosocial issues. And this theory is aligned with the social work values and ethics through many different things, which including like the promotion of self-respect and self-acceptance. And it also helps empower clients to become more active in the resolution of their problems and help empower them and give them a voice in it as well.
So in cognitive behavioral theory, it involves the client and the social worker to work together and uncover the client's negative thoughts that they're having. And by doing that, they want to bring about a more healthy and positive perspective for the clients instead. So the first ethical concern that we would have is the social worker doesn't allow the client to make their own goals, doesn't have choices, or doesn't have a say in the method of treatment that they receive. And this is just a problem because as social workers, we want to make sure that our clients have full autonomy. We want to make sure that they're able to make their own decisions. And we want to make sure they have a say in things. In cognitive behavioral theory, the relationship between the client and the social worker is really important. And during these sessions, the social worker is going to provide a high level of emotional support for this client. And they're also going to be really empathetic. So another ethical concern that could happen here is that the social worker doesn't set specific boundaries. And it can become a really unhealthy relationship between the client and the social worker. There's a possibility that the social worker could become too emotionally invested, or that they could start oversharing. And so by reflecting on their own emotions, behaviors, and attitudes, and expressing opinions and being able to be open with their supervisors about any questions that they may have about ethical dilemmas, social workers are going to be able to better display an appropriate ethical morality. And these are our sources.